Welcome to While We Were Distracted, the podcast where we explore topics that often get overshadowed in the rush of daily life. Please take a moment to like and subscribe. It really helps.
Welcome to today's deep dive, where we're going to be um, taking a look at a question you've sent in about the U.S. healthcare system.
Okay.
You sent over a whole bunch of GAO reports on different agencies,
Right.
the VA, Medicare, CMS, HRSA, even HHS itself.
Mm-hmm.
And you've noticed something pretty interesting.
Yeah.
They all seem to be struggling with similar problems,
Uh-huh.
especially when it comes to things like data management,
Yeah,
cybersecurity, and even like basic infrastructure.
definitely.
So your big question is,
Mm-hmm.
why not just have one streamlined program
Right.
to handle all these shared challenges?
Like, why are we doing this so many times?
Yeah, across the board.
Exactly. It's a question that I think goes right to the heart of government efficiency.
Right.
And I think these GAO reports that you've provided really do highlight some of the potential redundancies that are going on here.
Yeah.
You know what I find really interesting is that each agency has its own unique mission.
Right.
So you've got the VA serving veterans,
course.
CMS overseeing Medicare and Medicaid, HRSA focusing on healthcare access.
Right.
They're all tripping over these same hurdles.
Yeah, you would think that with issues as complex and as critical as cybersecurity, a unified approach would make sense.
Absolutely.
But from what I'm seeing in these reports, it's almost like every single agency is building their own separate cybersecurity fortress.
Yeah, and that's where the GAO really starts to ask why it's not just about a lack of willingness to collaborate.
Right.
They actually point to some pretty deep-rooted obstacles.
Oh, interesting.
So, for example, when it comes to cybersecurity risk management,
Okay.
the GAO found that agencies often lack a standardized way to even assess their vulnerabilities.
Oh, wow.
Some are using outdated systems, others have different criteria for what constitutes a high risk,
Mm-hmm.
and it makes it basically impossible to get a clear picture of the overall cybersecurity landscape.
So it's not even just about sharing resources or best practices.
Right.
They're not even speaking the same language
Exactly.
when it comes to assessing the problem
Yeah,
in the first place.
exactly. And, this lack of standardization also kind of bleeds into their data management practices.
Okay.
We see this especially with CMS and their oversight of state-run Medicaid programs.
Right.
Each state collects and reports data so differently,
Uh-huh.
which makes it so difficult for CMS to track performance, identify potential fraud, or even ensure that federal funds are being used effectively.
It's like trying to put together a puzzle where all the pieces are totally different shapes and sizes.
Yeah.
No wonder they're struggling to get a clear picture.
Exactly. And this data fragmentation has real-world consequences.
Oh, I bet.
The GAO report on the SBA's pandemic relief programs
Mm-hmm.
is a prime example.
Okay.
Because of inconsistent data collection practices on fraud, it was so difficult to assess the true extent of the problem and hold bad actors accountable.
So they were basically flying blind
They were flying blind.
when it came to program oversight.
Exactly.
And that not only wastes taxpayer money,
Right.
but it also erodes public trust
Ac-
in these crucial programs.
Absolutely. And, you also highlighted the VA's initiative to overhaul its medical supply purchasing. They're trying to modernize their systems and streamline the procurement process.
Right.
But at the same time, the Defense Logistics Agency, which handles similar functions for the Department of Defense,
Uh-huh.
is embarking on its own separate modernization effort.
So it's the same problem, different agency.
Right.
But this time it's about infrastructure and logistics,
Uh-huh.
not just data and cybersecurity.
Right.
It seems like this duplication of effort is a recurring theme.
It is, and this is where the GAO raises some pretty compelling questions about whether this siloed approach is really the most efficient use of resources.
I mean, it doesn't seem like it would be.
Right. Could the VA and DLA be saving time and money by collaborating on these modernization efforts?
Yeah.
Could they be leveraging each other's expertise and avoiding these costly redundancies?
Makes you wonder.
These are the kinds of questions that I think the GAO is prompting us to consider.
Yeah, for sure.
Yeah, it really makes you wonder if there are any successful examples of interagency collaboration,
Right.
maybe in other sectors of the government
Mhm.
that could offer a roadmap for healthcare.
That's a great point. I mean, surely the government's figured this out somewhere, right?
Well, one example that comes to mind is the intelligence community.
Okay.
After 9/11,
Right.
there was a big push to improve information sharing between different agencies like the CIA, the FBI, the NSA.
Yeah.
And they had their own versions of these data in cybersecurity silos.
Right.
And as we know, that failure to connect the dots had
Huge.
catastrophic consequences.
So what did they do to address that?
Oh,
Did they like create some kind of super agency to
right.
overseeing every?
Not quite. They
Okay.
created the Office of the Director of National Intelligence,
Okay.
or ODNI.
Okay.
And it basically acts as a central hub
Got it.
for coordinating intelligence gathering and analysis across the entire intelligence community.
So it's not like a perfect system,
Right.
but it's at least led to some improvements.
It has. It's definitely led to improvements in information sharing and collaboration.
Interesting. So instead of trying to like merge all these agencies into one,
Right.
they created this separate entity
Right.
to facilitate collaboration
Exactly.
and set some common standards.
Mm-hmm.
Do you think something like that could work for healthcare?
It's a really interesting idea.
Yeah.
Like, what if we had an OD&I for healthcare
Right.
to tackle all these shared challenges?
Yeah.
So imagine a central body that could establish consistent cybersecurity protocols.
Okay.
Or, develop a framework for data sharing
Uh-huh.
that would ensure patient privacy while also allowing for better analysis and oversight.
Right.
I mean, this could potentially streamline a lot of processes, save money, and improve outcomes.
But wouldn't there be like pushback from all the agencies?
Oh, absolutely.
Like they're all used to doing their own thing.
Yeah, they're used to operating independently.
Right.
So buy-in, I think, would be crucial. This couldn't just be a top-down mandate.
Right.
It would have to be a partnership
Yeah.
where each agency really sees the value
Mm-hmm.
in working together.
So it's not just about telling them what to do.
Right.
It's about showing them.
It's about showing them how working together can actually help them achieve their individual missions more effectively.
Okay. I could see how that approach would be more palatable.
Right.
But what about like leadership for
Yeah.
this hypothetical healthcare OD&I?
Mm-hmm.
Would it need a strong leader to really drive change?
I think so, absolutely.
way.
And not just any leader.
Right.
I think they would need a really deep understanding of both healthcare policy
Mm-hmm.
and the complexities of government bureaucracy.
Yeah.
And it would also take someone with like a really strong diplomatic touch
Right.
to navigate all those sensitivities we were talking about.
Yeah.
This wouldn't be an easy job.
And let's not forget about funding.
Oh, of course.
Creating a whole new entity would likely require a significant budget.
Right.
Do you think Congress would be willing to pay for something like this?
Well, that's always a challenge, especially in like a tight budget environment.
Right.
But the potential cost savings from increased efficiency,
Mm-hmm.
I think, could be a very persuasive argument. If
Okay.
you can show that a more collaborative approach
Right.
could actually save money in the long run.
Yeah.
That might be enough to get lawmakers on board.
Yeah, it's definitely a complex issue
Absolutely.
with a lot of moving parts.
It is.
But, as we've been discussing, this deep dive isn't just about theoretical models and government processes.
Right.
It's about real people's lives.
It is.
And if there's a chance that a more collaborative approach could lead to better health care for veteran seniors, low-income families,
Yeah.
all the people that these agencies serve,
Right.
then I think it's worth exploring.
I completely agree. And that brings us to another crucial consideration.
Okay.
How do we actually measure the impact of these potential changes on patients themselves?
Yeah.
Because at the end of the day, that's what really matters.
It's really easy to get lost in the weeds when you're talking about, government agencies and all this stuff.
Right.
But you're right. We can't lose sight of the human impact.
Very exact.
I mean, if we're going to be talking about streamlining healthcare,
Mm-hmm.
we need to make sure that it actually translates to better care for patients.
Yeah, we could create the most technologically advanced system in the world,
Right.
but if it doesn't actually improve people's lives, then what's the point?
Yeah.
So I think as we're considering these potential solutions,
Mm-hmm.
whether it's like a centralized program or just better interagency collaboration,
Right.
we need to be asking ourselves, how is this going to impact patient access,
Okay.
quality of care, and overall experience with the healthcare system?
Okay, so let's start with access.
Okay.
What would that look like in a more coordinated system?
Mm-hmm.
Does it mean like shorter wait times at the VA?
Yeah.
Easier enrollment in Medicare?
I think those are definitely part of it, but
Okay.
it's also about reaching the people who are often left behind.
Right.
Think about rural communities
Mm-hmm.
that are struggling with healthcare provider shortages,
Right.
or low-income families who are trying to navigate the complexities of Medicaid enrollment.
Yeah, it can be really tough.
Yeah, a more coordinated approach could help address some of those disparities by pooling resources,
Mm-hmm.
streamlining eligibility processes, and, maybe leveraging telehealth technologies to expand access to those underserved areas.
That makes a lot of sense, but access is only one part of the equation.
Right.
What about the quality of care itself?
Yeah.
How do we even measure whether a more collaborative system actually leads to better health outcomes?
Well, that's where data becomes really crucial.
Okay.
And we're not just talking about like collecting more data.
Right.
It's about making sure that the data we do have is high quality,
Uh-huh.
that it's standardized, and that it can be easily shared between agencies.
Okay.
So imagine a system where a patient's medical records,
Mm-hmm.
regardless of whether they're seeking care at a VA hospital
Right.
or through a Medicare provider,
Okay.
are easily accessible
Yep.
and provide a comprehensive picture of their entire health history.
Right.
This could help reduce medical errors,
Right.
improve diagnosis and treatment,
Yeah.
and ultimately lead to better outcomes for everybody.
So it's about connecting the dots,
Yeah,
not just between agencies, but between different points in a patient's healthcare journey.
exactly.
But even with the best data and the best technology, healthcare is still at its core about human interaction.
Right.
So how do we make sure that a streamlined system like this doesn't sacrifice that personal touch?
I think that's such a critical point.
Yeah.
Efficiency can't come at the expense of empathy.
Right?
We need to design systems that empower providers to spend more time with patients, that
Mhm.
make it easier for people to navigate the system
Right.
without feeling lost or overwhelmed, and that prioritize patient-centered care.
So it's a multifaceted challenge.
It is.
We need to improve access,
Uh-huh.
enhance quality,
Yeah.
and preserve that human connection.
It's a tall order.
It is, and it seems like to do that, collaboration is going to be essential.
Absolutely.
Not just between agencies, but between policymakers, providers, and patients themselves.
I think that's a really great point.
Yeah.
Finding the right solutions is going to require, like, a collective effort.
Yeah.
We need open and honest conversations,
Mm-hmm.
a willingness to learn from each other,
Right.
and a shared commitment to putting patients at the center of everything we do.
Well, this deep dive has been really fascinating.
Yeah, it has.
We've learned a lot about all the complexities facing U.S. healthcare agencies.
Absolutely.
We've seen how things like data fragmentation,
Right.
cybersecurity vulnerabilities,
Yeah.
and that siloed approach
Mm-hmm.
can really hinder their effectiveness.
For sure.
But we've also seen the potential
Yeah.
for a more collaborative approach to really streamline these processes, to improve outcomes,
Yeah.
and ultimately to deliver better care to the people who need it most.
I agree. And I think as you continue your own exploration,
Yeah,
the key takeaway is don't be afraid to ask the tough questions.
right.
Challenge the status quo.
Mhm.
And always remember that behind all those government acronyms,
Right.
in those policy debates,
Yeah,
there are real people
absolutely.
whose lives are being directly impacted
Yeah,
by the decisions that we make.
that's a great point. Well, thank you so much for joining us
Of course.
on this deep dive into the world of healthcare agencies.
It was my pleasure.
We hope it's provided you with some valuable insights
Yeah.
and some food for thought as you continue to learn about and grapple with these really important issues.
Absolutely. Thanks for having me.
Thanks for being here.
Check the description for more info on how to attain the full list of priorities. Join X.com and voice your opinions on the priorities for government reform by engaging in the conversation. Tag at Doge and at Non-Citizen 5.